Socioeconomic status affecting access to health services. What is SES? Socioeconomic status, also known as SES, refers to a person's or group's social standing or class in society compared to others. It includes three factors: income, occupation, and education. Socioeconomic factors are important determinants of health and well-being in Australia. The higher an individual's education, income, or occupation level, the healthier they usually are. SES and access to health services. Individuals with a lower SES receive less diagnostic tests and medications for more chronic diseases and have limited access to health services due to cost, coverage, and knowledge. Generally speaking, individuals from lower SES groups are at greater risk of experiencing poorer health, having higher rates of disability, illness, and living shorter lives compared to individuals from higher SES groups. People in low SES areas are less likely to receive longer GP consultations compared to people in more advantaged areas. Longer consultations have been found to be associated with better quality of care. Health during adulthood is shaped by SES factors experienced during childhood and additionally from disadvantage over an individual's lifetime. There are several barriers associated with socioeconomic status in terms of affecting access to health services. Cost is one of the main ones. Many individuals and families who are on low incomes are unable to afford to access particular health services. Even with Medicare, there can still be out-of-pocket expenses for medication, specialist surgery, and dental care. Many low SES people may not be able to afford private health insurance. Transportation is another barrier. Some people who have low SES may have reduced transportation options in terms of affording a car or public transport. This can cause issues associated with getting to medical services. This is particularly prevalent for older Australians and those living in rural and remote areas. Occupation is also a barrier. Some people's jobs can cause them to have less access to health services. For example, working long hours, shift work, or travel can reduce a person's ability to access health services during opening hours. People with high level of responsibilities within their job may feel they are unable to take time off work to access health services, and casual and self-employed employees may not have sick leave, meaning they would not be paid if accessing medical services. Education is also a barrier. Those that have not completed or have obtained limited schooling may not have the ability to process, understand health information and services in order to make informed decisions regarding their health. Data and statistics. During 2015 to 2016, 27% of people living in socioeconomic disadvantaged areas who need to go to the dentist delayed or avoided doing so due to costs, compared to 11% of people living in areas of least disadvantage. 34% of people living in areas of greatest disadvantage had private health insurance, compared with 77% of people living in areas of least disadvantage. The rates of avoidable and premature deaths, if provided with timely and effective healthcare, were 1.8 times higher in the lowest socioeconomic group compared with the highest. In 2009 to 2011, deaths from all causes in the lowest socioeconomic group was 29% higher than those in the highest socioeconomic group. Hopefully this presentation has helped you understand socioeconomic status in regards to affecting access to health services. There are other resources available.